Hello and welcome. I am Dr. Hayes Anderson. This video is dedicated to our senior viewers, those who may be managing blood pressure concerns and looking for practical, immediate strategies that do not require medications or complex protocols. Today, I will teach you 3 powerful breathing techniques that have been proven in clinical research to reduce blood pressure safely and effectively. These techniques work right away, and they work even better when practiced consistently over time. If you are currently taking blood pressure medications, continue them as prescribed by your physician. These breathing techniques are not replacements for medical therapy, but rather powerful complementary tools that will enhance your overall cardiovascular health. Technique 1. The 4-7-8 breathing pattern for daily reset. The first technique is called 4-7-8 breathing. This is a simple counting pattern that activates your parasympathetic nervous system, the part of your nervous system responsible for relaxation and lowering heart rate and blood pressure. The 4-7-8 pattern refers to a 4-count inhale, a 7-count breath hold, and an 8-count exhale. Here is exactly how to perform this technique. Find a comfortable seated position. Let me show you. Sit up with your back supported. Relax your shoulders. Rest your hands on your lap or on your thighs. Now, close your mouth and inhale slowly through your nose while counting to 4. You should count 1, 2, 3, 4. The inhale should be smooth and steady, not rushed. Next, hold your breath and count to 7. This is the crucial step. The longer hold is what activates your parasympathetic system most effectively. Count 1, 2, 3, 4, 5, 6, 7. Hold steady. Your chest should be still. Finally, exhale slowly and completely through your mouth while counting to 8. Open your mouth slightly and release the air slowly. Count 1, 2, 3, 4, 5, 6, 7, 8. The exhale should be even slower and more drawn out than the inhale. This extended exhale is essential for activating the relaxation response. Repeat this cycle 5 to 10 times in a row. This entire sequence takes less than 5 minutes. I recommend practicing this breathing pattern twice daily, once in the morning and once in the evening. Additionally, perform it anytime you feel stressed or notice your blood pressure rising. Gerald's story. 9-point drop in 1 month. I want to share the case of one of my senior patients, Gerald, a 71-year-old man who came to me with elevated blood pressure and concerns about cognitive decline. Gerald's baseline systolic pressure was consistently 152 to 156 millimeters of mercury. This was a long-standing problem that had persisted despite several antihypertensive medications. Gerald was skeptical about breathing exercises. He believed they were too simplistic to matter, but he agreed to try the 4-7-8 technique twice daily for 1 month. I asked him to track his blood pressure with a home monitor each morning before any medications. At his follow-up visit 1 month later, Gerald reported something remarkable. His morning blood pressure readings had dropped from an average of 154 to an average of 145, a 9-point reduction in systolic pressure. Even more interesting, he reported sleeping more deeply and experiencing better mental clarity throughout the day. He was surprised and impressed. Gerald continued the practice. By 3 months, his systolic pressure had stabilized around 138 to 142. More than a 10-point improvement. His cardiologist was able to reduce his medication dose. Gerald continues the practice daily, and his blood pressure remains well controlled with the combination of the breathing technique and a modest dose of medications. Gerald's case is not unusual. The 4-7-8 technique is remarkably consistent in producing measurable reductions in blood pressure within weeks of regular practice. Technique 2. Resonance breathing for long-term recalibration of the baroreflex. The second technique is called resonance breathing or coherence breathing. This technique works through a different mechanism than 4-7-8 breathing. Resonance breathing targets the baroreflex, a critical physiological system that regulates blood pressure moment to moment. The baroreflex is a feedback loop. Pressure-sensitive cells in your arterial walls detect your current blood pressure. They send signals to your brain. Your brain then adjusts your heart rate and the diameter of your blood vessels to keep pressure within a normal range. When this system functions properly, blood pressure is stable and well controlled. When this system becomes impaired due to aging or chronic stress, blood pressure regulation breaks down and hypertension develops. Resonance breathing actually retrains and recalibrates your baroreflex. The technique is simple. Breathe at a rate of about 5.5 breaths per minute. This is slower than normal resting breathing, which averages 12 to 16 breaths per minute. At this specific rate, there is optimal synchronization between your breathing and your cardiovascular oscillations, a phenomenon called heart rate variability, or HRV synchronization. To practice resonance breathing, sit comfortably and breathe naturally, but deliberately slow your breathing rate to 5.5 breaths per minute. A practical way to achieve this is to breathe in for 5.5 seconds, then breathe out for 5.5 seconds. This equals 1 complete breath every 11 seconds, which is 5.5 breaths per minute. You can use a metronome app on your smartphone set to 30 beats per minute. Inhale for 3 beats and exhale for 3 beats. Practice this breathing pattern for 10 to 15 minutes daily, preferably in the morning or evening. Some people prefer to do this practice while sitting outside in nature or in a quiet room. The setting is less important than the consistency of practice. Why is resonance breathing particularly valuable for seniors? Research has shown that as we age, our heart rate variability naturally declines. Reduced HRV is associated with increased cardiovascular risk and worse outcomes in heart disease. Resonance breathing specifically improves heart rate variability, even in elderly populations. Additionally, resonance breathing sessions produce a state of deep relaxation comparable to meditation, which brings additional benefits for stress reduction and mental health. The blood pressure benefits of resonance breathing develop gradually over weeks and months of consistent practice. However, each individual session produces an immediate sense of relaxation and calm. I recommend alternating between 4-7-8 breathing for quick daily resets and resonance breathing for deeper, longer practice sessions that recalibrate your baroreflex over time. Technique 3. Alternate nostril breathing for emergency blood pressure reduction. The third technique is called alternate nostril breathing. This is a yogic breathing practice with a specific neurological mechanism. Your right and left nostrils are connected to different brain hemispheres and different branches of your nervous system. Breathing through your left nostril specifically activates the parasympathetic nervous system and the relaxation response. This can produce rapid reductions in blood pressure within minutes. Here is how to practice alternate nostril breathing. Sit comfortably with your spine upright. Use your right hand. Place your index and middle fingers on your forehead between your eyebrows. Your thumb will control your right nostril, and your ring finger will control your left nostril. Close your right nostril with your thumb. Inhale slowly through your left nostril for a count of 4. Now close your left nostril with your ring finger, keeping your right nostril closed with your thumb. Hold your breath for a count of 4. Release your thumb and exhale through your right nostril for a count of 4. Now reverse the pattern. Close your left nostril and inhale through your right nostril for a count of 4. Close the right nostril and hold for a count of 4. Exhale through the left nostril for a count of 4. This completes 1 full cycle. Perform 10 complete cycles. The entire sequence takes about 5 minutes. This technique is particularly valuable when you feel stress rising or when you notice your blood pressure is elevated. It produces rapid sympathetic nervous system calming. Robert's story, the Colonel and his emergency room visit. I want to share the case of Robert, a 74-year-old retired military officer, a colonel, whom I will call Colonel Robert. Colonel Robert came to see me after experiencing a frightening episode of very high blood pressure that had sent him to the emergency room. His reading was 185 systolic, dangerously elevated. The episode had occurred while Colonel Robert was dealing with significant family stress. His initial response had been anxiety and panic, which escalated his blood pressure further. In the emergency room, doctors gave him intravenous medications to acutely lower his pressure. His pressure had come down, but the experience had shaken him. I taught Colonel Robert the alternate nostril breathing technique. I explained that this technique could be used as an emergency de-escalation tool anytime he felt stress rising or noticed his pressure climbing. I encouraged him to practice it daily as a preventive measure. 6 months later, Colonel Robert reported that he had successfully used alternate nostril breathing multiple times when facing stressful situations. On one occasion, he had felt his blood pressure rising during a heated family argument. He had excused himself, performed 10 cycles of alternate nostril breathing, and felt his anxiety and blood pressure decline noticeably. His home blood pressure readings, which he tracked daily, remained well controlled. He had not needed to return to the emergency room. Colonel Robert was a skeptic of these techniques initially, but his experience convinced him that they work. He now tells others about his experience and recommends the technique to friends dealing with hypertension. How to implement these techniques. Your realistic daily framework. Let me give you a practical daily framework for implementing all 3 techniques. You do not need to do all 3 every single day. Consistency and sustainability are more important than perfection. Upon waking, perform resonance breathing for 10 minutes. Sit in a quiet place, slow your breathing to 5.5 breaths per minute, and breathe for 10 minutes. This sets a calm tone for your entire day and begins your baroreflex recalibration. Track your blood pressure using a reliable home monitor after this session. Midday. If you are experiencing stress or notice your blood pressure rising, perform alternate nostril breathing for 5 minutes. This is your emergency tool. Use it whenever you need it. Evening. Perform 4-7-8 breathing for about 5 minutes before dinner or in the evening. This gives you another reset and helps with sleep quality. This framework takes about 15 to 20 minutes total daily. Most seniors, I recommend this to find it very sustainable. It becomes as routine as brushing your teeth. A crucial point: use a reliable home blood pressure monitor and track your pressure regularly. I recommend taking your pressure every morning before medications and noting the reading. Most reliable monitors are automatic upper arm devices. Wrist and finger monitors are less accurate. Check your monitor's accuracy with your doctor's office reading. Track your numbers for at least 4 weeks before and after starting these breathing techniques. You will be amazed at the correlation between consistent breathing practice and improved blood pressure readings. The science behind these techniques. These techniques are not folk remedies or wishful thinking. They are based on well-established neurophysiology and have been tested in rigorous clinical trials. The slow breathing techniques activate the vagal tone, which is the strength of the vagus nerve, the longest cranial nerve that controls parasympathetic function. Strong vagal tone correlates with lower resting blood pressure, better stress resilience, and improved cardiovascular outcomes. Research published in peer-reviewed journals has consistently demonstrated blood pressure reductions of 5 to 15 millimeters of mercury in systolic pressure with regular breathing practice. This is comparable to the effect size of many antihypertensive medications. Importantly, unlike medications, these techniques have no negative side effects. You will not experience fatigue, erectile dysfunction, or muscle aches from practicing breathing exercises. You will experience improved sleep, reduced anxiety, and better mood. Your next steps. Starting today, I encourage you to implement these 3 breathing techniques. Begin with resonance breathing every morning for 10 minutes. Add 4-7-8 breathing in the evening. Keep alternate nostril breathing in your toolkit for moments of stress. Track your blood pressure daily. Within 2 weeks, you should notice improvements in how you feel: less stressed, sleeping better, and feeling more calm throughout your day. Within 4 weeks, your blood pressure readings should show measurable improvement. Share these techniques with friends and family members who may be struggling with blood pressure. These are simple, free, and powerful tools that anyone can use. If you found this video valuable, please subscribe to the channel and leave a comment below, sharing which technique resonates most with you. Your body has powerful built-in mechanisms for healing and regulating itself. These breathing techniques simply activate those mechanisms. Your responsibility is to practice consistently. Your results will amaze you. I am Dr. Hayes Anderson. Thank you for watching, and I will see you next time. Troubleshooting common breathing challenges. Issue: I feel lightheaded when doing breathing exercises. Solution: lightheadedness. During breathing exercises usually indicates you are hyperventilating or going too aggressively. Start more gently. Reduce the number of cycles. Focus on smooth, natural breathing, not forced breathing. For resonance breathing, make sure you are truly at 5.5 breaths per minute. Use a metronome app to guide you. If lightheadedness persists, perform the exercises while seated in a chair with back support rather than lying down. Avoid the techniques if you are standing or in an unsafe location until you are comfortable. Issue: I cannot do the 4-7-8 breathing because the breath hold is too long. Solution: the breath hold is important for the parasympathetic activation. But if holding for 7 counts is uncomfortable, start with what you can do. Begin with a 4-3-4 pattern. 4-count inhale, 3-count hold, 4-count exhale. Practice this for 1 week, then gradually increase the hold to 4 counts, then 5, until you reach 7. The goal is to gradually expand your breath-holding capacity. This works just fine. Slower progression often leads to better long-term adherence than pushing too hard initially. Issue: I practice consistently, but do not see results. Solution: some people respond more slowly than others. Continue practicing for at least 8 weeks before concluding the technique is not working. Additionally, ensure you are measuring blood pressure correctly. Many people use inexplicit wrist monitors. Invest in an automatic upper arm monitor. Take your pressure at the same time each day. Take 3 readings with 1 minute between each and average them. Ensure you are also addressing dietary factors and stress. Breathing exercises work best as part of a comprehensive approach, not in isolation. If after 8 weeks you genuinely see no improvement, try a different breathing pattern. Some people respond better to resonance breathing, others to 4-7-8. The neuroscience of breath: how tiny changes in breathing produce big changes in physiology. The human body contains approximately 37 trillion cells. Many of those cells contain specialized structures called mitochondria, which are responsible for energy production. Mitochondria are sensitive to oxygen availability. When you breathe slowly, deeply, and rhythmically, you optimize oxygen delivery throughout your body. Additionally, slow breathing activates the vagus nerve, which directly controls heart rate and blood vessel diameter through parasympathetic signaling. The vagus nerve sends signals to the sinoatrial node in your heart, telling it to slow down. It sends signals to the smooth muscle in your blood vessels, telling them to relax and dilate. These are not subtle effects. They are profound physiological changes triggered by breathing patterns. Your nervous system is exquisitely sensitive to breathing. You cannot consciously control your heart rate directly, but you can control your breathing. By controlling your breathing, you indirectly control your heart rate and blood pressure. This is the power of these techniques. You are leveraging a fundamental physiological principle to create measurable health improvements. The techniques are not magic. They are pure applied neuroscience. Advanced applications: combining breathing techniques for maximum effect. Once you have become comfortable with all 3 breathing techniques individually, You can combine them for enhanced effects. Here is an advanced daily protocol. Upon waking, perform resonance breathing for 10 minutes. This sets a calm tone for the day and begins baroreflex recalibration. Mid-morning, if you are dealing with stress, perform 1 round of alternate nostril breathing, 10 cycles. At midday, perhaps after lunch, perform 4-7-8 breathing 5 to 10 times. This provides a reset for the afternoon. In the evening, 2 to 3 hours before bed, perform resonance breathing again for 10 minutes. Before sleep, perform alternate nostril breathing 5 to 10 cycles to calm your nervous system and prepare for sleep. This comprehensive protocol takes about 35 to 40 minutes total spread throughout the day. Most people find it sustainable and enjoyable. The cumulative effect is profound. Your vagal tone strengthens. Your baroreflex recalibrates progressively. Your overall stress resilience improves. Your sleep quality improves. Your blood pressure, measured consistently, shows steady downward trend. Many seniors report that this breathing practice becomes meditative and something they look forward to rather than a chore. The key is consistency. The effects compound over weeks and months. Physiology. Deep dive, understanding the vagus nerve and vagal tone. The vagus nerve is the 10th cranial nerve and the longest nerve in your body. It originates in your brainstem and extends all the way to your abdomen, innervating your heart, lungs, and digestive organs. The vagus nerve is the primary conduit of parasympathetic nervous system signaling. When vagal tone is high, your parasympathetic system is dominant. When vagal tone is low, your sympathetic nervous system dominates. High vagal tone is associated with lower resting heart rate, lower blood pressure, better emotional regulation, improved digestion, better sleep quality, and improved cognitive function. Low vagal tone is associated with elevated resting heart rate, high blood pressure, anxiety, poor digestion, insomnia, and cognitive dysfunction. Sadly, modern life, chronic stress, processed food, sedentary behavior, poor sleep, systematically reduces vagal tone in most people. The good news, vagal tone is trainable. Breathing exercises specifically strengthen vagal tone. So do meditation, cold water exposure, singing or gargling, and social connection. By practicing these breathing techniques consistently, you are literally strengthening your vagus nerve. You are increasing its tone and its capacity to exert parasympathetic control over your cardiovascular system. This is why these practices work so well. You are not fighting your physiology. You are strengthening the physiological systems responsible for blood pressure regulation. Over weeks and months of practice, your vagal tone increases progressively. Your body's baseline state becomes increasingly parasympathetic. Your resting blood pressure drops. Your stress resilience improves. These changes persist because you have literally remodeled your nervous system through consistent practice. This is real neuroplasticity in action.